When you stimulate the mu receptor externally for too long, your body files for neurochemical bankruptcy by shutting down its own natural pain relief system. Welcome to the Padda Institute. I am a physician with over 30 years of clinical experience in anesthesiology, interventional pain, metabolic health, and addiction. I am also an entrepreneur who has operated dozens of businesses in the healthcare space. Our center in St. Louis was built on a simple belief that is becoming increasingly rare in modern medicine. Pain is not a diagnosis, it is a signal. It is an alarm from your body indicating that something in your structure, your metabolism, your nervous system, or your lifestyle has drifted out of balance. Today we are addressing one of the most misunderstood frontiers in modern medicine, the intersection of chronic pain, opioid dependence, and the long-term failure of pharmacological management alone. St. Louis is a hub for world-class medical care. Our location is strategically positioned near Lambert St. Louis International Airport, making us a gateway to relief for patients traveling from across the country. We understand that if you are seeking specialized treatment for chronic pain or opioid dependence, your time is valuable. We have streamlined our consultations and procedural workflows to minimize your time away from home. To understand why opioids often fail as a long-term strategy, we must look at the cellular level. Chronic opioid medications target the mu-opioid receptors. These are G-protein-coupled receptors located throughout the central nervous system. These receptors are the primary site of action for both exogenous and endogenous opioids. Exogenous opioids like oxycodone or morphine, and our own internal endogenous opioids known as endorphins. When these receptors are stimulated, they inhibit the transmission of pain signals through the activation of inhibitory pathways. However, the human body is an incredible machine of homeostasis. When it detects an overwhelming and sustained external supply of a signal, it undergoes downregulation. During this process, the nervous system reduces the sensitivity and the density of these receptors. More significantly, the brain detects the high level of external stimulation. The brain shuts down the production of endogenous endorphins because the external supply is masking the need. This is the biological foundation of dependence. You are no longer just treating pain, you are replacing a vital internal neurochemical system with an external pharmaceutical one. When your body stops producing its own natural painkillers because it is relying on a pill, the medications have essentially hijacked your survival circuitry. This is why medications alone fail long-term. They treat the symptom by suppressing a receptor while simultaneously degrading the body's natural ability to manage pain signals. This leads us to the gate control theory of pain, a foundational concept in neurobiology first proposed by Ronald Melzack and Patrick Wall. Imagine a neural gate in the dorsal horn of your spinal cord. This gate determines which signals are allowed to travel up the spinothalamic tract to the brain. Large diameter nerve fibers carry non-nociceptive information like touch and pressure, which tend to close the gate. Small diameter fibers carry pain signals that tend to open the gate. Our endorphins are the neurochemical keys that keep that gate closed. When a patient becomes dependent and their own endorphin production has cratered, that neural gate is effectively stuck in the open position. This creates a state of hypersensitivity, often referred to as opioid-induced hyperalgesia. In this state, your nervous system is no longer calibrated correctly. If you experience a new injury, even a minor one, the pain signal will be perceived as much more severe than it would be in a healthy system. I will offer a contrarian viewpoint that is often ignored. Many clinics are happy to keep patients on a stable dose of opioids for years because it is easier. I reject this model. Endless prescriptions without a plan to fix the underlying terrain are a disservice. Addiction medicine is about rebuilding the environment of the nervous system. Rebuilding requires a data-driven, physician-led approach to metabolic health. We must address systemic inflammation, sleep architecture, and nervous system regulation. We use specific nutritional interventions and precise interventional blocks to support the brain as it slowly resumes its own production of endorphins. At the Padda Institute, we are here to help you change those signals. Whether you are local or flying into STL, we are ready to be your gateway to relief. Together, we can silence the signal of chronic pain.